Representatives of NICE International on a field trip to rural hospitals in northern China. They're advising the Chinese Ministry of Health and partners on a pilot clinical pathways project.
NICE International is the consultancy division of the National Institute for Health and Clinical Excellence based in the UK. We offer advice to foreign governments about introducing clinical and cost effectiveness issues when it comes to prioritisation decisions in their own healthcare systems.
NICE provides clinical guidance and sets quality standards for the UK's National Health Service. NICE International is working to spread that expertise.
NICE International, being part of NICE, is able to draw on over 11 years' experience of making very difficult choices for our National Health Service in the UK with regards to appropriate treatments and guidelines for the best management of people with various conditions or diseases. The Chinese government, and we're working with appropriate officials from the Chinese authorities, are embarking on a major set of health reforms centred around expanding quality healthcare to their rural populations. And we've been involved in helping them define their clinical pathways, which are sort of simplified clinical guidelines, and helping them actually develop appropriate assessment strategies for looking at what impact those pathways are making.
The Clinical Pathway Project is a pilot project working in rural China to help regulate healthcare service in the countryside. The project helps clinics provide standardised healthcare service to rural residents, and the experience of NICE in this area can help us to build a healthcare service of international standards. NICE conducts research, practice and evaluation on clinical excellence. The success that they have achieved in the United Kingdom is extensively recognised around the world, and we believe that this is a good opportunity to combine their work with our experience here in China.
The NICE team that went to China included physicians like Tony Rudd.
We spent our time in China visiting a number of rural hospitals, meeting with the local clinicians and the local politicians, being taken on ward rounds, actually talking to patients. So we were able to get a very tight feel really in terms of what was happening. We gave talks in the hospital, we met with the hospital management teams and spent quite a long time discussing how they might implement care pathways, for example.
The Chinese colleagues were responsive to the advice.
NICE has changed my view on the Clinical Pathway Project and healthcare service so that I can provide extended diagnosis and treatment to my patients.
It's been a very successful project. It's allowed us to build up trust with our Chinese colleagues. This should hopefully lead on to a deeper engagement with them and actually the possibility of setting up a bespoke or Chinese version of NICE in their country, which will take into account their own system, characteristics and their own social values.
If we can establish NICE in China, it will help us to regulate healthcare service and to use our limited resources more effectively, which will in turn create better value for individuals.
In
the UK, NICE is the model which sets the standards of framework and techniques for medicine, and this can be learned from by many countries.
The Chinese example shows the importance of reform being led in country, but a little experienced advice can go a long way.
Our aim at NICE International is to help our partners in countries all over the world to set up structures, set up institutions, to help them improve the quality of health services provided to their own citizens.